Okay, we're going to get started with our Director of Workforce Transformation, Diane Hank.
Good afternoon, everyone. Thanks for joining us for informational session number 6 in our ongoing series designed to assist MSCs with our transition to health home care management. As a reminder, I want to tell you that sessions 1 through 5 are all current and posted on the OPWDD website. So if you have missed any of those, you can certainly go back there and see the recorded presentation as well as the slide deck. I also want to point out that our next 2 sessions are listed on your screen. So on March 14th, we'll be going into some more detail, trying to keep it extremely practical to give you some updates on the CCOs, training for you, and enrolling individuals into health home care management. I realize on the title it might look like I'm talking about training individuals, but no, we don't mean that. We mean training for you that will help you be prepared. Session 8 is a really important topic on cultural competency, and there we'll try to explain why this is so very important for all of you going forward as care managers. The registration information for those is on your screen as well with that link, and all of these information sessions do count towards your professional development requirements for OPWDD. So today, we're going to move forward with more information on the transition and what you need to know, and most importantly, what you need to do to educate and enroll individuals that you currently provide MSC for. And so Kate Bishop, our Director of Program Development from the Division of Person-Centered Supports, will take us through the next half hour and then answer your questions.
Thank you, Diane. Good afternoon, everybody. Thank you for your participation today. We're really pleased to have the level of engagement and the number of people who've been participating in this morning or this afternoon, early afternoon, 12 o'clock session, and this afternoon session. This is really a critical juncture where we're shifting from providing you with just general information, understanding of what a CCO is, and information about the systems change and the benefits of the new health home care management model, to really getting into the details of what activities will need to be undertaken in order to move forward and complete that transition. And we are very appreciative of the work that you all are doing to learn and to partner on this transition because it will require us all working together in order to achieve a good and smooth transition for people who are supported in the current MSC service. So let's talk a bit about the purpose of today's presentation. Over the next several months, you will have some significant activities related to the transition of the CCOs and the move into the care management, the health home care management system. We want to talk about what those specific activities are today to give you a bit more detail. There will be training in this area, but today is the beginning of defining those specific activity areas. We want to ask you and request your help and dedication to work in partnership to achieve this smooth transition in order to ensure that people who are receiving supports and services have the most positive experience possible. We know that this kind of systems change, the amount and intensity of the education and the work associated with this, can create some anxiety with you all in the workforce, anxiety with the people receiving supports and services. So the more that we can make sure the information is clear and that you understand the expectations and the individuals and families are understanding what is happening in this transition, the smoother it will go. So we want to make sure that we're providing you with information and guidance to share with individuals and families about transitioning to the care coordination organizations. So your role as an MSC, as I've stated, your role as an MSC will be a critical role in informing the individuals and families about care coordination organizations. You will inform them of the 2 care management options offered by the CCO. And I think one of the things to just make sure we're clear to all of you and everyone in the field, there's been some kind of urban myths or myths out there that if you just kind of don't make choices, maybe everything will stay the same and the MSC service will continue to be in place. And I just want to clarify with you that is not the case. The MSC service will sunset in July 1st of 2018 as the CCOs come on board. So the choice of the individual will be of a care coordination organization, and then within that, the care coordination organizations will be delivering the 2 different care management options. So those 2 options are the health home care management, which is a robust and comprehensive care management. The health home care management is the service that takes what you've been familiar with in the MSC model and is really broadening and empowering and enhancing that support and service through investments into the service and expansion of the supports that someone would be providing support around. So the idea of including the health management for an individual as well as the behavioral health management is a large part of that critical transition. We'll talk more about the differences between these 2 options, but the key messaging in these first slides is that both of those options are available within the CCO, but the transition to a CCO is the required transition of everyone today receiving supports and services. So how are you going to do these tasks? There's a lot of activity that will be underway over the next several months, so we wanted to just talk a bit about what you'll need to know in order to achieve this transition as smoothly as possible. And first is understanding the health home care management and basic HCBS plan support services. So you need to know what the differences are, what the benefits of the health home care management supports are, and be able to understand that enough to confidently educate the individuals that you are providing case management for about the options and the benefits within each of the options. So it's important for you to have a clear understanding, and your participation in these sessions, the info sessions, and watching them online and reviewing materials that are available on the website all help to inform your understanding of the systems change and put you in a better position to be able to educate individuals on the care management options and benefits. Your participation in that education process will include clarification around questions that might emerge related to the care management decision so that people are able to make an informed choice. Your role will also involve supporting individuals to record the choice that's made by the individual or their family or decision maker in the choices system. And you'll need to obtain the consents for the chosen care management option and share the documentation of the choice and the consent with the appropriate CCO. So this is really just an overview of all of the elements, and now we're going to go through some of them in more detail that really give you a sense of what you'll need to do over the next several months to be ready for and able to implement a smooth transition for people that are currently on your caseload. One thing that I also want to be clear in this discussion, some current Medicaid service coordinators will be becoming care managers, and they will be able to, they will be undertaking these tasks as an MSC, knowing that they're moving into the care management role in the future. Other MSCs today may not be moving into a care management role as the system transitions. However, the work that we're describing today is for the current MSC workforce. It's pre-7-1 activities, so it will need to be undertaken by the current MSC workforce. Anyone who currently has a caseload of people supported under the service coordination role will need to be working with them on these critical tasks for the transition into the CCO. So we want to make sure that you have as much information and you are provided with resources to be able to educate individuals about this transition, people who are currently receiving MSC and PCSS, to assist them with the transition to care management by July 1, 2018. And to that end, we've created a toolkit. The toolkit will be available to you on March 28th. to be used in the discussions and the communication and dialogue that you'll have with the people on your caseload about the options available to them. So the toolkit will consist of a CCO information brochure, and that brochure will highlight what is the available supports and services in the health home care management model. It will also identify what the benefits of that model and have a description of what will be in the basic plan of support, so that you'll have clear information to share with individuals, family members, and decision makers about the change in the system. There will be scripts available for you all to help engage and educate individuals and the decision makers in their lives, so that you have a clear framework of what types of discussions need to take place associated with the transition. One of the things that is important to note as far as scripts for MSCs and some of the talking points is that it's okay for you as an MSC, and again, as I mentioned, some people are going to be transitioning from a current MSC role into a care management role, and it will be fine for you to share that with the individuals on your caseload if you will be continuing in a relationship with them and moving forward into the new role for the same people that you're currently providing service coordination for. So that's something that you should feel comfortable with, if that in fact is the case for you, because it is something that we were focused on in the development of this model that is allowing for relationships to have some continuity, and it may be very important to many people. There'll also be an example in the toolkit of the informational letter. Each of the information letters that are provided, and that will also be made available to MSC providers on 328, will be the opportunity to identify the CCOs that are available within each of the regions that the person resides in, as well as the agency affiliations, the relationships between the current MSC providers and the CCOs within the region. So you'll be armed with information about that as part of the toolkit. There'll be documents for the individual selection of care management, and there are frequently asked questions documents that will be helpful to you to describe frequently asked questions related to MSC and the future of care management services, as well as frequently asked questions of individuals and families about what will be different in the care management, health home care management system and with the CCOs. So we're going to go through each of these things a little bit more detailed throughout the course of the presentation. So when we talk about understanding, I gave a general overview earlier, but it's important to know that effective July 1, MSC services will end and new care management services will begin. So the primary new service will be the health home care management, and will provide coordination of the developmental disability services that individuals and families are currently receiving, as well as comprehensive coordination of other health and behavioral health care services individuals may receive. So the new health home care management is an expansion and an empowerment of the care management supports or the service coordination supports that are provided today, and will be an improved option for people receiving supports and services. So you must educate individuals and families about what they need to know about health home care management and basic HCBS support plan options. And you'll do that, you'll provide that education by meeting or speaking with everyone that you provide MSC or PCS services to before July 1, 2018, to inform them of this new change. Now, for some people, that's going to be very easy to achieve. They're people that you interact with regularly, and for others, there may be a bit more, there might be a little bit more to do relative to people who need assistance around decision making. So we'll talk a little bit more about that, but the intention is that as you start to educate people, you will work with people where there could be many people who can very quickly kind of make this transition and choice, and we're hoping that the toolkit materials will give you all of the information that you need to be able to provide that information to individuals and families so that they can make the informed decision. So you must clarify, as you're discussing and educating with the individuals and families that you're talking with, that OPWDD has enhanced the coordination service by implementing the CCO model and wants people to benefit from this more robust comprehensive service. That individuals will be able to choose the CCO they want to receive care management from, and that individuals and families may continue to receive the same services and supports, including self-directed services from their current provider, unless they request a change in service and or service provider. And this is really an important point to clarify. We've heard in different listening sessions across the state that some of the worry from individuals and families is about the potential changes to their current supports and services, and there has been some additional questions for people who are choosing the self-directed model of service delivery. So it's important to clarify with individuals and families that this change from MSC to the CCO will not impact their current services and supports, that those will remain in place, including their self-directed services, as we transition into the new coordination care management model. So you must clarify that the alternative option of basic HCBS plan support services primarily focuses on planning related to only HCBS services and does not coordinate any other health or behavioral health services. And the basic plan support service is very similar to PCSS, and it only requires reviewing and updating a service plan as well as ensuring an annual level of care is completed. And there were questions during the last session about how many contacts there would be for someone getting basic plan of support, and the minimum number is 2 and the maximum number is 4 in that basic plan of support service. So it really is a basic service, and as you can see in this benefits of health home care management and the comparison to the basic HCBS plan support, you know, we as a system, the OPWDD, the state, the health department, and our federal partners are really encouraging the health home care management model because it is much more holistic. It is where we are investing in the use of technology, and the technology is such that it will help to facilitate improved communication for individuals and families about their supports and services with the providers as they find appropriate in their planning process. So the health home care management will include the coordination of OPWDD supports and services, coordinated access to behavioral health services, coordinated access to medical and dental services. It identifies community-based resources, uses technology to link services. Again, as I mentioned, the use of technology to share information and provide updated information is something we've talked quite a bit about in some of the other information sessions because it's a critical element to enhancing the ability to coordinate supports and services as well as health and safety supports to individuals receiving services. The health home care management connects with your care providers and takes the burden of navigating some of these complex systems away from families in many instances where those families have been the responsible party today. The basic HCBS plan support really is focused just on coordinating the OPWDD supports and services and doesn't require the other elements that is described here in the health home care management. I will state that both of these, health home care management and basic plan support, do have an element of monitoring for health and safety as any service model would within our system, but the level and the ability to achieve stronger health and safety monitoring is significantly enhanced in the health home care management model, where communication can be much more in real time and can be much more readily shared across various support providers. So after the education and information sharing, you must support an individual's ability to make the informed choice and use the informational letter as a guide. And as I mentioned earlier, but I'll repeat again because I know this is a lot of new information for people, the informational letter will include the specific CCOs that are operational in the individual's region of the state, and they will identify the relationship that the current MSC provider has with the CCO, if that remains an active partnership through an affiliation, so that the individual will have information that assists them in making the choice that they need to make. The individual's enrollment, by assisting them to complete the required consent forms, must be supported by you. So you'll support that through obtaining a signature on those consent forms. And accessing a decision maker if the person is not able to decide independently. Now, we're going to have some future training related to this. We're actively engaged in finalizing an emergency regulation associated with the decision making, but I want to make a few quick points here relative to decision making. Many people make decisions on their own today, and for those individuals who are able to make decisions, they will be making this decision of this nature. This doesn't set any sort of a higher standard than the current decision-making standards that we have in place in our system today. For individuals who have actively involved families making decisions on their behalf, those people will be able to continue to be actively involved decision makers, and where there's legal guardianship and other people who have been legally designated to make decisions on a person's behalf, such as the CAB, those decisions can take place. So for those people, you'll know that they have active decision makers. So what we're asking you to do, well, the additional training is being developed, and we'll have some future process steps associated with the group of people where they can't make decisions on their own and they don't have a decision maker in their life. And we want you to start to think about that group of people so that when the process is defined, you are really ready to go and you're able to identify who the people are that will need that extra support during this transition process. And it's by identifying and being as proactive about identifying those people that will assist in ensuring a smooth transition to the CCO care management services as we move forward. So once that decision has been made, you will document the individual's or the decision maker's choice in the choices system, and that screen will be available as of April 15, 2018. So in the meantime, if choices are made prior to that time, say between 4/1 and 4/15, you can document it on paper, and then it can be attested to in the choices screen when the choices screen becomes available. But the decision that's reached must be documented in that screen, and the choice must be documented by June 30 of 2018 for all individuals receiving MSC or PCSS. For people who are transitioning from MSC and PCSS into this new service, the new care management service will be required for their continued continuity of their service plan. So that June 30 date is a very important date. So then you must obtain completed consent forms for the individual's current service plan and the individual's current service plan, meaning the ISP, and the state-approved assessment summary, the CAS or DDP-2. Those must be obtained as part of your onboarding process, and then share that information, that documentation, the document of choice, the consent, the service plan, and the state-approved assessment summary, whether it's a CAS or a DDP-2, with the chosen CCO. So those are the activities that would be undertaken over those next several months. So let's just review quickly some of the timelines associated with these activities. And again, we recognize that this is a great deal of activity over a relatively short time frame, so we're trying to be as helpful to you all in achieving this goal. We want you to understand what's expected. We're giving you a lot of tools to help assist with completing these tasks. So let's just quickly walk through between now and July 1st, 2018. So beginning with the, once educated, the individual will choose the health home care management or the basic HCBS plan of support. The consent form is confirmed with a choice delineated, and then the CCO plan choice is input into the choices system, and this screen will be available as of April 15 of 2018. The individual will receive a letter regarding the choice made, and as of July 1, 2018, the CCOs will begin operating. And then here's a few more dates just to kind of understand these things relate to the prior slide. So 3/28 is an important date because that is when those individual letters will be sent to all of the MSC providers so that they will have the information about each person on their caseload, the CCO options available to them, as well as the affiliation of their current agency with the CCOs. At the 3/28 date is also when the toolkit will be available to people, so that will be provided along with the informational letters. So then beginning April 1st, MSCs can begin to conduct the education and distribute the informational packages and be able to use the information in the toolkit to educate individuals and then document choice and obtain the documents needed to be shared with the CCOs. Between 4:15 and 6:30, the choices selection screen will be available and will be updated based on the choices made by individuals. And then beginning in May, we know that there'll be, again, I mentioned earlier, there'll be some people where this transition will be much easier because it may be the same person moving with the MSC to the care management, and you have a lot of that information already in your system, and it can just, you'll complete the needed forms, but it won't be as complicated. There'll be other situations where there'll be a bit more complication. So what we want to do beginning 5/1 is make sure it's clear who's enrolled and who's not enrolled so that you begin to have information as MSC provider agencies, as MSCs who are educating and enrolling people to know where you need to focus your energies, who's in, who still needs to be contacted, and we'll be providing that information, and we'll work in partnership between the DDROs, the MSC providers, the CCOs, and central office to ensure that there's as much information and education around these tasks and where we are against the deliverables on a regularly occurring basis. So what are the next steps? There'll be some additional MSC information sessions, and Diane mentioned the next two at the beginning of this presentation. We are in the process of developing a more in-depth online training that will focus on these same enrollment activities, but dig a little deeper into each of the areas, and so that we will be announcing and will be available soon. Our goal is to have that available mid-March so that you can begin learning more in-depth information about each of these things I've talked about today. The regional offices have scheduled and completed many forums with MSC providers, and we will continue to work with the provider system to make sure that everyone is well informed about these transitions. And in summary and conclusion, I really just want to again thank you. As I've said a couple times, we know this is going to be a workload, and this is a system transition, and change is always difficult, but our goal is really to work with you to help support you through this transition, and that you as seasoned MSCs are really essential to assisting individuals to receiving services to transition to the health home care management and enroll in a CCO that will provide the care management service. We know that you are a critical element in this discussion. You have a lot of trust and relationships with the people who are on your caseload, and we want to arm you with the right information to help facilitate this transition as smoothly as possible for the individuals that you're providing support to, and for you as dedicated employees within our service system. The work that you've done over the years and will continue to do as we transition into the care management world is essential. So I just want to take this minute to thank you. Thank you for your work. Thank you for your anticipated work, and we look forward to continued education and partnership as we transition into the health home care management model and CCOs. And now I will stop and take questions that people may have relative to this material.
Okay. We did get a couple good questions that I kind of compiled because there were some that were kind of asking the same question. But if the person has private insurance anything other than Medicaid, will there be any impact with enrolling into the CCO or either of the care management services?
That's a great question. Absolutely not. So today, if you have third-party insurance, which is probably for most of our people in our service system would be employer-based insurance that their parents have, for example, you get Medicaid service coordination today paid by Medicaid, and you have your private insurance. That will continue with the CCO Health Home Services. So that has no effect on the person's ability and need to choose between either the Health Home Care Management or the HCBS, basic HCBS plan support.
Thank you. Okay. Will the consent forms allow for families and individuals to identify exactly who they would like their information shared with, as well as which providers they'd like their care manager to be able to contact?
Yes, that's a fabulous question. And yes, there will be an ability for the individual to identify who they want their information to share with. That's really an important part of what a consent form is all about. It's the ability to identify who your providers are and what level of access to information you want them to have. In today's world, the people who are getting HCBS services in our waiver have agreements with those services because you must know what the person's safeguard needs would be and share that information among providers in order to effectively support the individual and implement the plan. But as additional providers are identified within a person's health home care management plan, they will have some ability to control who gets what level of information across those service providers. So thanks, that's a great question.
Okay, thank you, Kate. What will happen if an individual and or his or her representative does not sign a consent form?
So this question came up in the last session as well. And in order to have a continuation of services and supports within our system, you need to have someone in a care management role. Those two options for care management are either the health home care management or the basic HCBS plan of support. So the person would have to choose one of those two options, or they'd be at risk of compromising their current service plan. You have to have a care management person to coordinate your supports and services.
If there are people on caseloads now who receive MSC but do not receive HCBS services, can they choose to enroll in the CCO Health Home or basic HCBS plan support?
So yes, the answer to that is yes. If people are currently getting either PCSS or MSC today, they can make a choice and transition to either basic or health home care management as they move forward.
Will it be necessary for a person to have waiver services to enroll in basic HCBS plan support?
No, waiver services are not required in order to enroll in basic health home care support. You must be eligible for services and meet the level of care definitions in order to be eligible for this service.
So if I could just jump on that. So for example, today we have people enrolled in Medicaid service coordination who may be receiving personal care services. Those folks would have the types of choices we're talking about, and they might not be receiving HCBS waiver services. There are not many people, but we do have some people that sort of have that kind of service profile.
And there were many questions about the DDP-2. If an individual has a current DDP-2 on file, will MSCs need to do a new DDP-2 for?
If a person has the goal of, let me just back up a minute on the gathering and review of the assessment. And you will see, you will be familiar already with the requirements in the person-centered planning regs. Where there is a CAS, a Coordinated Assessment System summary available, that must be used as information to inform the development of a person-centered plan. If there is not a CAS available, the DDP-2 will serve as the functional assessment until the CAS is completed for purposes of informing the care plan. The regularly occurring need to complete DDP2s as already existing in the system would just remain the same until we transition fully into the CAS.
Thank you. I'm just looking to see here.
Bear with us, we're just reviewing your questions so we can get, make sure we get as many answers as possible to you today.
Just trying to think of. In children who receive EI services, will they be able to choose CCO Health Home or basic care management services, and how will that work?
So today, we will be clarifying that, and we are looking at it, but today, kids who are in EI, particularly those who are getting ready to transition to OPWDD services, typically receive plan of care support services in addition to the EI services, since EI services integrate care management as part of their service package. So we are definitely looking at continuity of care for those kids. That will continue, but we will be clarifying that in a few short days. But we can assure people that for the few children that are in that group, there will be continuity of care.
Thank you. Just looking at the questions that are coming in.
Yeah, there was a question related to the benefits of joining the health home care management as opposed to the basic plan of support. So I'm just quickly going back to the slide that describes those benefits. One of the major areas of focus, I mean, there's really two critical areas that we want you to understand and be able to educate individuals and families about, but the health home care management is a much more robust service. For people who need ongoing assistance with their supports and services and who may have changing needs over time and who are receiving a great deal of services within the system, or who need support to access services on a regular basis and whose desire for services may change readily during the course of their supports and services, will be benefited through the health home care management process. It helps people, and I guess I can try to give you a couple specific examples that could be helpful, including access to behavioral health and access to medical and dental services is a critical area that is not part of the basic plan of support, but would be for people who have health home care management. And the need for ongoing dental care we know is a significant need within the system. And having the health home care management would be of great benefit to assist individuals to make sure that there's a clear ability to access that service and that the coordinator care manager is working to identify those services within their region and help the person be able to access it in a timely way. Another key area is the use of technology. Right now, we have a lot of paper documents that get brought here and there and mailed or lost. Having an IT system to support the care management activities is critical to improve communication. It's critical to share real-time information about a person's changing needs, to implement safeguard plans in a more effective way. So, really when you talk about what is beneficial to the health home model, using the slide and using the information that you will get in the brochure for the CCO health homes will really help you be able to identify these critical differences and the benefits of the health home care management model for people receiving supports and services in our system.
Thank you, Kate. And one last question. If people do not sign the consent form, what will happen with those individuals that there's not a signed consent on file as of July 1?
Well, again, the risk is that without a care manager, how will your plan get developed? Without a consent, you haven't decided on who your care manager is. And without, a clear decision around the health home care management versus the basic plan of support, you will not have designated someone to take on that role. And as in today's system, that role is critical to develop a plan of support, to monitor a plan of support, to access supports and services, both within OPWD's service system and to other providers of health and behavioral health support. So not consenting and not designating an entity for that role will put your current supports and services at risk.
So we also have a question about family councils for CCOs and why they have not yet been designated. The point of the family councils is that they are made up, individual and family councils. They're drawn from people who have selected to work with a CCO. So until someone makes that choice, those councils wouldn't be created. So when people make the choice, and the CCOs are serving people, then they will form those councils. They're a required element of each CCO, but at this point, because people have not yet enrolled, there's no one to draw from to create those councils. So they absolutely are part of the operating requirement of CCOs, a very important element, but until somebody makes that choice, those councils those seats can't be filled, if you will. So that absolutely will be forthcoming, but the first thing is for people to make their choices.
Okay, thank you.
Can you, I know this isn't directly related to this, but can you share about how there will be no changes to self-direction? There's a couple questions about self-direction.
Okay, sure. That keeps coming up, and I'm hoping that through these education sessions it will clarify for people. But as in today's world, the broker and the FI services are part of the waiver service system, and the MSC is responsible for the development of the ISP, which includes the description of those services. In the health home care management world, the same requirements for the health home care manager will be in place as with today's MSC. They will define within the life plan the fact that the person is choosing to self-direct their services. They will include the services that support that person to do a self-directed plan, including the FI and the broker, just as today it would be in the ISP. So the self-directed service plan will continue to have the same waiver provider of service for the implementation of their self-directed plan as in today's world. There's no changes, just to really hit this home, there's no changes to the current PRA levels for people who are choosing self-direction within the CCO world. There's virtually no changes to the way that a person is supported, other than we've recognized in the tiering system that you can see in the transition plan and in the application that for people who are choosing to self-direct their services, there may be some added complexity to the care management role because we know that a person may not have as much of a safety net from a provider managed service system. So they actually receive a higher weighting within the tiering model so that people who choose self-direction actually are reimbursed at a higher level or can fall into a higher tier as a result of the fact that they've chosen self-direction with budget authority. So we've tried to incorporate knowing that the coordination role, the care management role for someone who is self-directing their services may be an enhanced role from today's current PCSS or MSC provision of coordination.
Will care managers be able to be brokers?
So let me answer that. So there are federal rules about care managers actually also directing and providing HCBS waiver services to the same person. So that is, from a federal perspective, a conflict of interest. If a care manager who is supporting someone to make choices about their service provider is also themselves financially gaining, if you will, because they're being paid to deliver an HCBS service. So that is an issue today. It is not unique to the CCO health home model. It is a federal rule that has been in place since, I believe, 2014.
So to the same person is the key
Yes.
element in that description.
Yep.
Okay.
I think that's all of the questions.
Okay. All right, thank you all very much. We appreciate your time this afternoon. Hope this information was helpful. And again, we will be doing a more in-depth training related to many of these areas that will be available online in the second half of the month of March. And we will look forward to the questions you provided during these two sessions today to help us formulate the level of detail that can be provided in the course of that online training. So thank you very much for your time, and we look forward to continued partnership with you all. Have a good afternoon.